All right, I'm going to try this again. My power just went out and I have to restart the video. Thankfully, I was only a couple slides in, so it's not so bad. But I want to talk about health insurance around the world and in the US. I think this is important to know because many times we don't understand health insurance policies. So it's important to have an idea. So, health policy, this is the delivery of healthcare and how things will be paid for. Policy is going to determine where that money comes from. And typically in the US, insurance companies negotiate with hospitals and drug companies. So, the importance of and relevance to communication with health policy, public reaction. Many times it gets a negative public reaction. Rollout of the policy and implementation and maintenance also affects communication behavior. So, couple things we're going to cover: health insurance lingo, types of insurance, and relevant policies like Medicare, Medicaid, Affordable Care Act, or Obamacare. So, terms. First, we have premium. This is the monthly payment to your insurance provider. Now, there are some occupations you may have in your life where you don't pay your premium, your organization does. That's currently where I'm at right now. My premium, because I'm not a smoker, I don't have health issues, I am not really a big drinker either. My premium is pretty low. I think it's like $25 for the whole month. I don't cover that. My organization does, but sometimes you do have to pay the premium. Deductible, this is the amount you are responsible before your insurance starts. So for me, my deductible is $600. So for $600, I am responsible for that. Once I have hit that $600 in out of pocket pay, my insurance will start to kick in. Copays, these are what you usually have to pay to the provider. Sometimes you don't have a copay, and that's great. Other times they are, 15, 20 bucks. To my primary care physician, my copay is $20 or 25. To urgent care, it's 50, right? My copay at the ER is like 75. And I don't think those go toward my deductible. I don't remember off the top of my head though. And then we have the catastrophic cap. This is the upper limit to out of pocket money required to be paid each year. So my insurance is supposed to kick in at $600, but maybe they don't, the upper limit is $800. So I have to pay that other $200 out of pocket each year to get that cap for my insurance to kick in. Okay. There are conventional or indemnity insurance. So it's a fee for service model. Providers receive payment or reimbursement for specific types of care, and they are suspected in overprescribing of tests and treatments for this fee of service, right? Oh, Kylie needs an EKG. We did an EKG, but I think we need to do another one. I had a hospital bill that was $2,100 a couple years ago. I couldn't afford that. My insurance paid $15 of it. 15. So they overprescribed echoes, EKGs, x-rays, CAT scans, because they get reimbursed for that. And with this conventional or indemnity insurance, which isn't what I had, but it's what we think of, there's this third-party payer system. So somebody else pays, and then you pay that third party. So in the notes section of these slides, there is a PBS explainer on the origin of our employee-based system. It's a YouTube video. Highly recommend watching it. So with this, you pay a set monthly premium. You also pay a deductible, and payments are constrained by a catastrophic cap, meaning they cannot go over that cap. So if you have to pay $800 a year out of pocket, they cannot go over $800 a year. Maybe I did have that insurance. With conventional or indemnity insurance, you can see any doctor or specialist. There's no referral required. There's no selection of primary care provider required. Premiums are the highest in these plans, though, often with a trade-off for a lower deductible, but this doesn't always happen this way. What most people probably think about, this is what most people probably think about when they hear health insurance. We've got high premiums, so I'm paying $300, $400 a month, but I might have lower deductibles. So I have to pay, I don't know, $200 a year out of pocket because you've got the high premium. There's managed care. This is health systems where patients can see only certain providers and use certain hospitals. And it creates a network of health services. And this is what most types of insurance are. You can't just go to anybody. You have to go to this certain doctor in this certain network at this certain hospital. It coordinates resources and costs for more efficient care, ideally. The costs are lower, but the choices of providers are often limited. So it's meant to focus on prevention. I go in to prevent things, so I'm not going in to deal with illness later. But costs have continued to rise. Managed care organizations recruit patients and match to providers and facilities. So they represent influence on care other than just the patient or the provider. Most physicians are members of managed care organizations. Most employer-based insurance is managed care. This is what I have right now. So, health maintenance organization, or an HMO, hires providers directly. Providers get paid via the monthly premiums and the smallest set of provider options. So you cannot use providers outside of the HMO. HMOs often have patients pay a copay, some fixed amount. So in here, this is a slide that I got from Dr. Tatsuke. His is $20 that he has to pay out of pocket per visit. I think my copay is $25, but it might be $20. I can't remember, but I pay out of pocket per visit. Lower copays tend to come with higher premiums, and many do not have deductibles. Okay. HMOs, insurers and providers are in the same organizations. So it's a capitated system, and they receive a set amount of money per monthly premiums. So it should reduce the incentives to carelessly prescribe unneeded tests and treatments, because whether you have me take 6 EKGs and a CAT scan versus 1 EKG and 1 CAT scan, you're going to receive the same amount of money because I have a set premium. Then you have preferred provider organization, or PPOs. So they are independent providers that are contracted to be a part of a network. They agree to provide patients in the PPO a discounted rate for service. The most common type of managed care in the US is a PPO. So the copay changes based on the procedure and the provider. Some coverage for out of network is very, very expensive. Deductibles and copays shift based on the provider being in network versus out of network and the service. So are you getting a checkup versus a cancer screening? So it's not a set deductible, it's not a set copay. For managed care in PPOs, there's the flexibility and provider choice. So it's contributed to their popularity because you have more option, potentially less conflict of interest because the providers don't work for the insurance company or the insurer, and you generally have higher premiums. So let's talk about universal coverage and Medicare for all. So universal coverage is quality medical services to all citizens. They have lower costs for patients, standard quality of care for everyone, and creates healthier workforce, so less need for emergency services. So quality medical services for all citizens. Medicare for All Act will provide comprehensive health care to every man, woman, and child in our country without out-of-pocket expenses. So there's no more insurance premiums, deductibles, copays. Further, this bill improves Medicare coverage to include dental, hearing, and vision care as well. In other words, this plan does or would do exactly what should be done in a civilized and democratic society. It would allow all men, women, and children in this country, regardless of their income, to get the health care they need when they need it. This is Bernie Sanders' current plan when he's the one that was really instituting it. So let's say you work for McDonald's. If you got Medicare for all, you have a job, you wouldn't have the premiums, but you'd still have a right to good health care. The difference between universal and Medicare for all is universal is all citizens, and Medicare for all is everyone in this country. So let's talk about some basics. There are three main types of private insurance. First, there's a fee for service. So any provider, varying premiums and deductibles. But not everything is covered or covered entirely, and you do have a catastrophic cap as well. So you pay providers based on the quantity of care, not the quality. So you go in for 3 EKGs, and the reason you have 3 is because they can't read them, they're not working with you, you get really crappy service, you're still paying for quantity. The Health Maintenance Organization, so HMO, lower premiums and copay, but reduce flexibility. I think I have the HMO plan. And Preferred Provider Organization, PPO, higher cost than HMO, but more coverage and more providers available. So Medicare, let's talk about Medicare and Medicaid. Medicare is a single payer national insurance for people age 65 and older from the Center of Medicare and Medicaid Services. Single payer is one entity, so the government. It collects the funds and gives provider reimbursements. It's not necessarily a universal healthcare where everyone is covered or socialized medicine. Government pays and directly hires providers. The government collects taxes and then pays a private insurance provider. Generally, private healthcare organizations receive Medicare patients, meaning it is not a socialized medicine program. So let's talk about Medicaid. This is federal state joint insurance program for socioeconomically disadvantaged Americans. So this is for persons of all ages whose income and resources are insufficient to pay for healthcare. The states provide up to half of the funding, and it offers some services that are not included in Medicare, such as nursing homes. Medicaid states that states decide exactly who is and who is not eligible, and some can now impose work or job training requirements under the current administration. States are not required to participate, but all do. The Medicaid expansion is by each state under the Affordable Care Act. So I'll let you know that Medicaid seems like it'd be this great thing. When I had a $2,100 bill, and I had student health insurance, so it didn't cover anything. So I was responsible for all $2,100 of it. My mom got sick. She got diagnosed with cancer, so she couldn't help me pay as much because she was paying on it and I was paying on it. So it ended up turning out that my boyfriend at the time ended up helping me pay off that debt, and then I just paid him back because I missed one payment, even though I had a 10-day grace period because I was waiting to hear back about Medicaid for assistance in paying this off. Because I missed it, they charged $200 extra. Medicaid told me I made too much money. As a doc student who made about $20,000 a year, I made too much money. Yeah. Then we've got the PPACA. It's Obamacare, or just Affordable Care Act. It was signed into law by President Obama on March 23rd, 2010. And it was upheld in the Supreme Court in June 2012 and effectively repealed under 2017 Tax Cuts and Job Acts. So it expands and improves access to care and curbs spending through regulations and taxes. The problem, so prior to 2013, over 44 million Americans had no health insurance. Many private insurance plans had too high of premiums for low-income families or individuals. Many subpar plans were on the market, but there was no real requirements for employers to offer health insurance to its employees. So the ACA attempted to provide access to affordable health insurance, improve quality of healthcare and health insurance, regulate health insurance industry, and reduce healthcare spending. Some key components were that it was fully covered. It fully covered routine physicals, so managed care, but only for in-network. They cannot deny coverage for pre-existing conditions, and provides dependent coverage for children up to 26 years of age. So that was really nice. Once you're 27 though, literally the month after I turned 27 and was kicked off my mom's insurance, I got blood clots, and that's where that $2,100 bill came. Yeah, the month after I turned 27. All right, so key components continuing. There's an individual mandate, so it requires health insurance to pay, it requires people have health insurance or pay $695 per year fine, or 2.5% of your household income, whichever is lower. It allows for funding for high risk individuals who may not otherwise be insured. It allows low risk individuals utilized care less, or that they utilize care less, leaving more for high risk individuals. And otherwise, plans for high risk individuals are more expensive to cover higher expenses. Some claim universal coverage is impossible without a mandate. It gives companies with less than or more than 50 full-time employees a fee per uninsured employee, full-time employee. It requires companies with more than 200 employees to automatically enroll employees in plan offered by the employer. It has since been repealed by the GOP tax law in December of 2017. So it requires more reporting and transparency, administrative simplification, and more regulations. It provided consumer protections, website and standards of coverage for insurers, new patients' Bill of Rights, and guarantee an appeal process for denied claims. Even if you appeal it, it doesn't do anything. Reduced Medicare payments to hospitals for preventable health readmissions and for hospital acquired conditions, and prescription discounts for seniors. So it requires restaurants to disclose nutritional content on food items with the Affordable Care Act. It requires certain preventative services in plans, and many more. So the Medicaid expansion, let's talk a little bit about this. It adjusts Medicaid eligibility to 138% of the federal poverty line in any state that accepts. $17,236 was the cost for one person in 2019. So for one, it was $12,490. For a family of four, it was about $25,750. Compared to about 43%, $8,935 for families only. Right, so this was the expansion, what it expanded to. There was a tax credit for 100 to 400% of FPL, up to $49,960,000 in 2019 via the ACA marketplace. And 14 states have not expanded their coverage. So West Virginia was a state that expanded as of September 2019. All right, adults left in coverage gap spread across all states without expansion. So these are people within the coverage gap where they are not covered, and no uninsured adults in coverage gap in Wisconsin. They had a Medicaid waiver. Adults under 50 were required to work 80 hours per month, and they had an $8 monthly premium. So you can read all about that down in the article that is in the notes section. So with the gaps, the employers' reactions, there were employer reactions to the mandate. Millions are still uninsured, and over 2 million adults in the US do not have coverage because the state didn't expand Medicaid coverage, immigrant eligibility restrictions, and income is too high for financial assistance. So if you make $20,000 or more, you have too high of an income. Yep. For the rest, premiums are rising. They're more expensive than mandate fees. Coverages are still not adequate. So again, I don't want you to actually fill something out and hand it in, but I want you to think about your positive or negative health insurance experiences. especially if you have WVU student health. If it was negative, why? If it was positive, why? And then just think about it, like what made the difference? All right, so next we are going to cover health insurance around the world. So I will see you in the next video for that. All right, bye.